Hi, good morning, everyone, and welcome back to the session that we are continuing our unit on, unit 5.18, which is managing quality in health and social care. We are looking at covering today the learning outcome 3, which is be able to evaluate systems, policies, and procedures in health and social care services. This is an interesting learning outcome, keeping in mind that we do see, a number of times policies and procedures being created and followed through within many organizations. And these quality policies and procedures, help us in maintaining and upkeeping the standards to which, any particular organization conforms to, whether it's because of legislation or it's because of compliance, or in some cases, because of the relation to vision, mission, and the, resonance or basically the existence of the organization. So some of these policies and procedures are essentially put into place to ensure that everybody sings from the same songbook, and it is to also ensure that there is consistency and efficiency and productivity within the system when people are going about doing their day-to-day jobs. Now, when we talk about relating this to health and social care, what we are looking at is primarily the aspect of most of the practitioners within health and social care, whether it's nurses, healthcare assistant professionals, medics, doctors, nurses, they all conforming to a standard set of procedures and policies which have to be followed in order to deliver care which is going to support and obviously going to provide the services which is going to help get patients better. Now, when we talk about these services, obviously from a context of health and social care, managing quality is about ensuring integrated care being delivered. The care which is being delivered is meeting the compliance and guidelines set by Quality Care Commission, CQC, like Care Quality Commission, CQC, some of the other regulatory bodies like NICE, and some of the advisory bodies which work with the Department of Health and the government in particular to, come out with white papers, policies, and sharing of best practices, which could be organizations like the King's Fund, SKY, SCIE, Socialcare Institute for Excellence. And then there are loads of others like Public Health England, the National Health Service in particular themselves, and any changes which are brought about for the betterment of delivery of these services to patients and clients would be conforming to quality. Quality is about consistency. Quality is ensuring that every time you do that task, the output of that, comes out or is basically the same. So in order to ensure that quality, is, when I say sometimes when you work and, you talk about quality, and when you say quality is basically nothing but standard, or the standard of doing something which is measured against other things similar, and over a point in time this standard has been set in stone. This degree of excellence, for example, means something, and this is how the care is to be provided. Or when we talk about the 6 C's of care, or we talk about person-centered approach, or we talk about putting people's first as an approach, these are things which have been brought into the policies and procedures of, or within the health and social care sector, and they are implemented within any health and social care setting. And the main aspect of this primarily is to ensure that when these aspects are say for example implemented, then what we are looking at is the services being provided by practitioners are meeting the quality of care which has been set and defined in the policies and procedures by CQC, not just from a point of view of policies and procedures, but also from a point of view of compliance, regulation, which has to be followed in order to deliver these services. So quality in general would mean quality of care, which is degree to which healthcare services for individuals and in particular, mass populations like members of public in the UK have to be provided, and the outcome of these services have a likelihood of getting the desired health outcomes. And that is the whole aspect of having, quality and quality implementation from a point of view of, health and social care sector. So here, when we talk about, there could be a different meaning of quality of, quality in NHS, quality in health, quality in healthcare services, quality in a care home, but they will all conform to certain legislation, regulation set by the CQC and some of these bodies. And they will all be looking at putting people first. They will all be looking at ensuring that the care being provided is meeting the needs of the individual. they will all be looking at meeting the policies which have been set or have been implemented within any sort of a care setting, would be looking at meeting the desired learning outcomes. In this case, when I say learning outcome, I wouldn't say health outcomes, which are, say, for example, presented in that policy. Now, when we look at this particular learning outcome, there are 3 assessment criteria. We are looking at first evaluating and understanding what are the effectiveness of systems which are used to put quality policies and procedures in place, and in specific with regards to a health and social care setting. The second one will be looking at factors that could be influencing the achievement of this quality standard that has been set within health and social care services. And last but not the least, we'll be looking at discussing ways in which health and social care services could help improve its quality. So how do organizations go about improving their quality, look at a corrective action plan, look at improving benchmarks and quality when they follow some of these policies and procedures. Now, there is a fair bit of content in the learning outcome 3 that we'll be looking at covering, and this will be divided across the 3 assessment criteria. So we're looking at evaluating quality systems and policies, influencing factors, and then suggestions for improvement. Our discussion will be centered around, this particular learning outcome using, say, for example, the PowerPoint presentation slide. And what I've got here is we will start up with, discussing things related to, the key terminology first. Now, in this policy, in this particular learning outcome, there are some terms which are going to be used repetitively, and these terms which are going to be used repeatedly essentially would be policies and procedures, what is a policy and what is quality. So it's worthwhile for us to get into a bit of understanding in terms of what is a policy, what is a procedure. So when we talk about policy in general, what does that mean? And when we talk about policy and procedure, what is the difference when we use the term procedure? Now, when we talk about policies and procedures in health and social care, we are looking at writing down step-by-step instructions on how to carry out a specific activity which is required to be done by a number of people or practitioners within the sector. So if you have to take blood, for example, bloods, for testing for diabetes or, for example, cholesterol from a patient, then there is a set specific procedure which all nurses will need to follow when they are inviting or, asking patients to provide blood samples, which are going to be later on tested for type 2 diabetes or, for example, checking cholesterol and, other aspects of, say, for example, diagnosis which needs to be done. Whether you have a thyroid condition, whether you're anemic, whether your hemoglobin is fine or not, whether your blood pressure is fine, whether you have high cholesterol, low lipids, whatever it is, iron deficiency. So all these are tests which are done using, by taking blood samples from the patient. Now, there is a step-by-step written instruction which is available, and that procedure will need to be followed by all nurses, healthcare assistant professionals to be able to take tests, to be able to take blood samples from a patient. Now, this particular procedure, which is written down in terms of how you go about taking those blood samples, is going to be documented as a procedure. And there would be a policy around it, and the policy would define what you need to do, how you need to do, if there are problems to encounter, what is to be done, and then in certain situations wherein it is not possible to draw out or take out blood samples, then who needs to be informed and what is the next process or step that needs to be done. And that is what is going to be the bits in terms of, policy and procedure. Now, in general, when we talk about policy basically states a clear clear position or provides a clear position of a particular, say, clear instructions or position about, a particular process. And policy in general basically would be related to principle, and they are going to be, say, principles or actions which could be proposed or adopted by an organization to carry out a particular task. Now, when we look at infection control, so an example of this would be when you look at infection control and how you intend to comply with national standards, that is a policy. When you look at a health and safety standard within an organization, you see a health and safety poster, you need to have a first aid box, you need to have a fire marshal or a first aider. These are requirements which are going to be defined in the policy, and there is no leeway in terms of meeting these requirements by all organizations which have employees working within a particular setup or, say, a building. Now, that is what is policy. It means it is going to provide guidelines, and these guidelines will be used meticulously by the organization to implement a process within the organization, and that would be an example of policy. Now, if we talk about procedure, so any questions, feel free to ask me. If there are any questions that you need to ask, please feel free, either through the chat route or while unmuting your microphone. Now, when we look at a procedure is a written set of instructions which is going to describe how you're going to carry out the process. Now, when we talk about procedures, they basically describe the policy, how it has to be implemented, and how the guidelines and principles given in the policy, when they are implemented using the procedure, are meeting the guidelines or regulations defined in the policy. So when we talk about, again, relating it to the example of infection control, now infection control, if there is an infection which breaks out, like for example, if cholera or diarrhea breaks out in the organization, that has to be reported to the health and safety executive. Now there are certain procedures or process through which the first aider, or say for example the health and safety officer in the organization would have to report this to the health and safety executive of the HSC. Now that process that has to be followed in terms of sending a written confirmation that there's a cholera or a diarrhea outbreak in the organization, so many people are affected. This is the process that the organization is now taking to overcome this particular infection, would be listed out in the procedure, and the reporting of that to the HSC would be done by the first health and safety officer, and that would basically be conforming to the policy. Now, sometimes we also talk about what is called a protocol. Now, protocol tends to be a written procedure or a plan which is defined in as a part of the policy and process, and this is to be enacted or put into action when you get to see that there is some sort of, let's say, when we talk about if then else. So for example, if this is the outcome, this has to be put into place, or if you face this problem, then you have to tackle the problem this way. So protocols tend to be what are called interventions, or a set of instructions which will help you deal with the interventions. And they tend to be quite explicit and specific in their guidelines in terms of what, when, where, how, what is to be done in order to overcome that problem. So when we talk about these three words, process, so we talk about, policy, we talk about procedure, and within the procedure, you have a protocol. That means if I need to follow this protocol, if I need to follow this procedure, I need to make sure that these are the protocols that I follow. For example, if I need to report the infection which is broken out in the organization to HSC, what is the protocol that I need to follow? That means you need to first do a phone call, then send a written confirmation via email, and then also document everything in the in your register within the organization with the details in terms of how it started and all, and that would be a protocol that you would need to follow in order to report this breakout. Now, one of the last things that we talk about is also something called a guideline. The reason I want to bring this in is because when we talk about policies and procedures and we talk about protocols, there is also sometimes the term guideline which is used. Now, guideline tends to define a particular principle or a criterion, and it asks you to do a specific action. Now, guidelines are specific instructions provided in certain cases by regulatory bodies, and they would expect that you need to follow these guidelines to implement the policies and procedures. So sometimes when you look at, say, for example, a guideline, like a guideline for, say, if I have to look at, say, a difference between a guideline and a policy. So just look at, when you look at guidelines, they are general recommendations. That means these are bits that you can follow through and implement in your organization, but are generally given out as guidance statements by regulatory bodies. Now, if you follow these guidelines, it may be that it helps you do certain tasks better. But if you follow these guidelines, it might, if these guidelines are given and they are not followed, then they also sometimes mean that when we differentiate between a policy and a guideline, a policy is mandatory. A guideline is recommended action that can be taken or should be taken. Now, in some cases, these guidelines are helping you to implement policies and procedures more effectively. And that is where you generally see that Public Health England and, for example, NICE, National Institute of Care and Healthcare Excellence, will bring out a lot of guidelines apart from policies which would help the organization implement, adapt, and incorporate a policy within their organization with the criteria of meeting some of these guidelines. So when we talk about guidelines, sometimes you would generally say they are journal recommendations and they are not mandatory required to be followed. And that would be the difference when we talk about policy and guidelines. Policy will be vision statements or statements which the ethos of the organization is based on. They can't be compromised. They can't be potential interpretations of that. But generally, guidelines would be documents which could be things which are recommendations which the organization can follow to implement a policy or a procedure within the organization. Now, when we talk about quality within the health and social care, I would want to basically look at a particular video. And this particular video that we are going to look at is going to be able to help us understand how the National Health Service is changing, and how they are putting how they are looking at implementing and changing some of the quality policies and procedures in time and in keeping with the changing times, in terms of how, say, for example, in line with the changing needs of patients' requirements to receive care and support services, from the National Health Service. So let's watch and listen into this particular video. It's a 5-minute video, and it will give us a very good perspective in terms of how quality and quality implementation happens within the National Health Service.
Big changes are taking place across the health and care system. What does this mean for the organisations that make up the NHS? How will they collaborate with other parts of the system? And what will these changes mean for you and me? When the NHS was set up, it focused on treating single conditions or illnesses. Since then, our health and care needs have changed. More of us are living longer, and many have multiple conditions that require regular, ongoing care. However, this hasn't been reflected in the NHS's structure, a patchwork of organisations that often work independently from one another. Navigating this can be confusing and can have a negative impact on our experience of care. So, for some years now, health and care staff and leaders have been working to bring organisations closer together to better meet our needs by working in a joined-up way. Primary and secondary care, social care, mental health, and community health services have been seeking to partner with each other in different ways. At a very local level, GP surgeries have been coming together to form primary care networks, groups of practices working together across areas called neighbourhoods. By sharing resources and working closely together with other local people and services, they can provide a wider range of services than a single GP surgery. Health and care organisations have also been working together across larger areas called places, often covering the same area as a local authority, where large parts of the NHS budget are spent. Here, local government, charities, residents, and NHS partners can work together to understand and meet local health needs. But previous laws have prevented services becoming even more joined up. The 2022 Health and Care Act aims to change this and make it easier for organisations to work together. But what do these changes look like? Organisations are now coming together across even larger areas to form integrated care systems, partnerships of health and care organisations that plan and pay for health and care services. There are around 40 integrated care systems across England, and although they've existed for some time, the Health and Care Act gives them legal status, as well as new powers and responsibilities. Integrated care systems are made up of two parts: integrated care boards and integrated care partnerships. Integrated care boards decide how the NHS budget for their area is spent and develop a plan to improve people's health, deliver higher quality care, and better value for money. Integrated care partnerships bring the NHS together with other key partners like local authorities, to develop a strategy to enable the integrated care system to improve health and well-being in its area. NHS trusts are also coming together to form provider collaboratives, new partnerships that can bring together providers such as hospitals, mental health services, and community services. So how are these new structures funded? Integrated care systems get most of their money from NHS England, which is the national body for the NHS in England, and sets the operational priorities for the health system. It's responsible for the health services you and I access day to day, which are inspected and regulated by the Independent Care Quality Commission. The Department of Health and Social Care sets out what the NHS is expected to deliver for the money it gets from the government, which comes from our taxes. It also holds budgets for some of the other areas that have an impact on our well-being, like public health. Throughout these new structures, local authorities play a key role. They receive money locally and from national government, which goes towards funding a range of services that support our well-being and prevent ill health. So, what does this all mean in practice? The Health and Care Act has put in place a legal framework that enables services to work more closely together, so it's easier for you and I to receive the care we need, when and where we need it. For these changes to succeed, staff and local leaders will have to work with one another differently, alongside key partners in local government, the voluntary sector, and communities themselves. Of course, services face other challenges like workforce shortages, growing waiting lists, and the impact of the COVID-19 pandemic. While the new structures won't fix all these issues, by enabling services to work more closely together and join up services for patients, it's hoped that the health and care system will be better able to meet our changing health and care needs in the future. Find out more about how the health and care system is changing at www.hingsfund.org.uk/explain.
So as you can see in this particular video, it talks about the changes which are coming to the health and social care sector. And the reason why we need to be aware of this is that is where when changes are introduced, you would generally see that, changes in the quality policy and procedures have to be implemented in order to keep them current and compliant, essentially with, guidelines and regulations which are released by some of the, regulatory bodies. Now, what we want to be able to do with this bit of understanding, we want to get into and understand that, in our case, what we would need to do is take a named organization. And with that named organization in mind, we would need to then look at, essentially taking an example. And with that example, we will discuss some of the other assessment criteria. Now, if I switch you back over to the presentation, what we are looking at doing here is primarily discussing, the first assessment criteria, which is evaluate the effectiveness of system policies and procedures in health and care setting in achieving quality in the services offered. So because it says health and care setting, so what I've done for the purposes of discussion, with regards to this particular assessment criteria and some of the others in this learning outcome, I've taken the Wythenshawe Hospital as an example, which is an example of health and social care setting. Now, when we talk about lots of these policies and procedures which are being implemented within a particular hospital because of the fact that they are required to be followed because of either regulation or in some cases meeting the compliance, what we are looking at is the hospital putting a quality system or a quality management system in place, which allows it to, implement some of these policies into what are called policies and procedures for carrying out day-to-day operations in the hospital. And these day-to-day operations are going to be carried out by staff, which is, nurses, doctors, medics, administrators, people in, different, say, for example, departments, which will be looking at providing these services to the patients. Now, when we talk about the implementation of policies, they have to put everything from an aspect of quality of care. That means they need to be able to meet the required standards which are described by the CQC, in particular when the University Hospital and the National Foundation, Trust Foundation in Manchester, which owns and is a part of owns the Wythenshawe Hospital, would need to make sure that they are effective and they are effective in providing care to patients. Now, when we look at some of the instances where some of these policies have slipped or procedures have slipped, and that has led to problems or issues even in terms of fatalities within the hospital with patients, that is where policies and procedures get checked. Now, when we look at, there was a bit of a blackout an alert in 2012 when the hospital experienced a situation wherein the patients had to wait in recovery until beds were made available. That means there was shortage of beds. And because of the shortage of beds, that meant that people being brought across by A&E or ambulances to the hospital and being transferred over to the wards, because of the shortage of bed, that meant that there was an increased risk to the life of the patients. Now, this particular, shortage of beds was basically picked up by the communications system, that when we look at the number of beds electronically available in the wards within the hospital and the number of patients being brought in, there was a mismatch. And obviously the system flagged it off, saying that the number of beds, we are short of beds, or the beds capacity has been reached. Now, this electronic management system, which allows, when patients are being checked in to see whether beds are available, what beds are empty or can be allocated to a patient, allowed the hospital to function in a very effective way. Now, this particular system was put into place to improve recovery, let's put it this way, to improve the allocation of beds to patients when they are, either being admitted to the hospital through A&E or have had a clinical procedure and then require them to be transferred over to a general ward or an ICU, and there is a requirement of a bed. Now, in this case, this electronic system, which has been put forward, allows access to the information to all medics authorized to get that information, whether it's nurses, healthcare professionals, doctors, or any sort of clinical staff, which is helping the medics and the practitioners in the hospital to take care of patients, and allows them to quickly transfer the patients from being processed and received through A&E onwards to a bed which has been allocated within the hospital. Now, this is a policy. Now, when we look at a guideline, there are some guidelines which are issued by the National Institute of Care and Excellence. And when we look at these guidelines, all care providers are required to access the physical and psychological needs of patients, which include their, hydration, pain relief, and nutrition. Now, in order to comply with these requirements, Wythenshawe Hospital has a policy, and that hydration bundle policy aims to monitor fluid intakes and output which the patient is having while they are admitted in the hospital. Now, this is a guideline, and on the basis of the guideline issued by NICE, what the hospital authorities have done, they've implemented a policy which is called the hydration policy bundle, and this allows the monitoring of the fluid intake and output for a particular patient. Now, aim of this guideline, which has been taken into account and developed into a policy, is to ensure that the patients, when they are within the hospital and have undergone treatment or undergoing treatment, are very well hydrated. Now, when CQC inspected, the hospital, they found 90% of this, policy not being implemented effectively. And they found that the fluid record charts, which were basically responsible for ensuring that patients are receiving, proper amount of fluids so that they are well hydrated, was not being kept up to date. And in this case, what the hospital did was they implemented a policy, but there was no monitoring of that policy as per the guidelines issued by NICE being done from time to time. And this meant that the welfare and the needs of the patients were maybe taken care of, but there was a maybe kind of a big question mark and was could be interpreted in two ways. One, whether this was being taken care of, or second, it was not being taken care of, but it was being taken care of, but the records were not being updated. And this then was a recommendation by CQC to ensure that they also have a procedure which needs to be followed, written, and that would need to be followed by the medics or the staff which are responsible for ensuring and implementing that policy within the hospital, the hydration policy bundle, to make sure that it is not just a policy on paper, but it is also being implemented within the hospital and meeting the needs of the patient to keep them hydrated while they're admitted or undergoing a procedure or have come out, of a clinical procedure. So as you can see, this example gives you a clear indication of how a policy has been created using a guideline from NICE, which is the hydration policy. But when we look at the implementation of the policy within the hospital, it has been done on paper, but not practically implemented. And when an inspection by CQC happened, it put down recommendations in place to say, although there is a policy on paper, but we don't see that policy updating the outputs in terms of how it is being implemented by the staff within the hospital. So there has to be a procedure defined and staff allocated to carry out that procedure, so that the policy and the procedure ensure that the policy and the procedure ensure that the guidelines are met. They are being implemented within the hospital and are meeting the requirements of the patient to keep them hydrated during the process of either they having the procedure or being admitted in the hospital. Now, this particular example illustrates how regulatory bodies come in and check your quality management systems. They look at picking up a policy and seeing whether there's a procedure available for the implementation of that policy, and then look at the output of that, which is recorded, and triangulate policy, procedure, and the implementation of that, and triangulate it to see whether this is being put into practice and is being followed by the members of staff, which the hospital claims that yes, they have a policy. And in order to ensure whether this is being followed, implemented, is checked through the inspection process, and that allows the monitoring and tracking of this to happen, and ensures that quality policies and procedures are put in place, and they are helping in achieving the quality of services being delivered to the patient. What are the quality of the services? In this case, the hydration policy bundle, which is to ensure that people who are admitted within the hospital are, in terms of their fluid requirements, input and output, or their intake essentially is monitored, and they are kept well hydrated with respect to this particular policy. Any questions on this? Do let me know. Now, the next bit that we talk about is in relation to looking at second assessment criteria, which is analyzing some of the factors that influence the achievement of quality in health and social care services. Now, here we are going to be looking at factors which are going to be, responsible or influence how the quality is achieved, or quality procedures that are implemented within the organization. Now, when we talk about quality, delivery of quality in terms of health and social care services, they could be dependent on a number of factors. Now, these factors could be factors which are related to resources, training of staff. It could be culture and structure of the organization. It could be standards and guidelines which are being followed. And last but not the least, the most important, which is legislation. Now, when we talk about these factors, how they influence the formation of policy within the hospital is what we will be looking at, with the use of this particular example. Now, for example, when we talk about, say policies, and when we look at resources. So when we talk about policies and resources in particular, what we would say is whether the hospital, for example, has adequate resources available, in terms of financial resources, administrative resources, human resources available to be able to put these policies into action. Now, this is something which is looked at through staffing. That means, does this hospital have adequate number of staff? And when we say the adequate number of staff, what we mean by that is, do we have enough people within the organization who are available to be able to carry out the day-to-day responsibility? So, for example, medics, doctors, nurses, healthcare assistants, administration staff, people who basically work and carry out some of the administrative functions are available. So, for example, things like administrative infrastructure would be, things like availability of beds, wheelchairs, availability of equipment is there in the hospital. When we talk about staff, we talk about different type of staff working in different departments, whether it's a laundry department, the wards, whether it's the reception, administration, doctors, consultants, nurses, healthcare professionals, are they available to be able to provide services? And then when we look at management in terms of staff in the management, which are basically going to be looking at implementation of these policies, procedures, management is responsible for ensuring reviews and appraisals, and also ensuring inspections and guidelines are being met and implemented to the standards which are recommended by CQC. So there will be people who will carry responsibility, people who would be looking at executing this responsibility on a daily basis, and there'll be people who would be essentially required to carry this out, and deliver some of these services to the patients. So training is one factor. So resourcing is another factor. Then the third factor that we talk about is availability of, so resources could also include money, and that is the points that are made on the first slide. Now, when we talk about other factors, you could look at other factors which I would say would be factors like legislation. Say, for example, when we talk about legislation, so legislation could be, factors like data protection being implemented, Data Protection Act being implemented. You look at Health and Safety Act or policy being implemented. We talk about, say, for example, the CARE Act of 2014 being implemented. There are so many of these different types of legislations which will be predominantly related to acts which have been introduced over the years by government, and these have then led to the creation of requirements, legal and regulatory requirements, which need to be followed by hospitals and hospital staff to implement when they are providing services to patients, which is care to patients. We talk about training of staff. So regular training of staff has to be done, and regular training of staff is required in order to ensure that they that they have the up-to-date knowledge and skills required to offer care services to the patient. So if there is, example, a new introduction of a machine or an X-ray scanner or an MRI scanner, then obviously people who are responsible for producing these scans or helping patients undergo some of these scans need to be trained in order to understand what are the new requirements of the machine, how the equipment has to be used, what kind of precautions have to be taken. And this kind of training would be required before the staff is competent enough to be able to use some of these new equipment and machines which are brought in to provide services or help in the diagnosis of any sort of illnesses or conditions with the patient. Culture of the organization, so NHS structure, organizational structure, as we would put it this way. So organizational structure within a particular hospital, who's on the top within the hospital, who's within the management, who's looking after quality and compliance, who's the head of nursing, who's the head of say, for example, clinical director, who's the head of doctors, head of healthcare professionals, people basically having their roles and responsibility clearly defined. And then this would be a mandatory requirement of how some of these factors could influence the services being provided by the staff within the setup. And that setup I'm talking about is hospital. Now, any questions on this? So these, I would say, is for this assessment criteria, you're looking at picking out any of the factors that have been listed down, things like legislation, standards, guidelines, resources, training, and structure and culture, and then take a point with an example of an organization and explain how the structure of the organization or the culture of the organization influences how these services or when, for example, how the implementation of quality policies and procedures are implemented, and how they affect the services being provided by members of staff to the patient in that particular setup or in the health and social care setting. Now, the last assessment criteria talks about, suggesting ways in which health and social care services could help improve quality. Now, there are lots of ways in which we could look at, suggesting how improvements can be done with regards to the implementation of quality policies, and they would then result in providing better service to patients. So when you look at setting standards, we are looking at primarily the hospital. So again, sticking to the example of Withinshaw in this case, they have recorded a number of significant improvements on quality, and over a point in time by implementing certain policies and procedures or guidelines which have been given, or corrective action plan which have been given during the inspections done by CQC. Now, there were, say, for example, when these inspections happen, there are several issues which can come up, and these issues then are addressed through what are called CAPs, corrective action plan. And these corrective action plans are then met with policies, met and matched with quality procedures and policies within the hospital. And then gap areas in terms of where they are not meeting the set requirements are picked up. And those gap areas which are picked up are then, looked at. So when we get to know that these are the gap areas, what will happen is hospital and the management would allocate staff resources in order to cover those gap areas. For example, if there is a shortage in terms of staffing, when we look at nurses within the general ward. Now, if this is got picked up and you have one nurse per 3 patients, and this ratio then expands to 1 nurse to 5 patients, but the guideline from CQC says one nurse can take care of 3 patients during a particular shift, and if it moves to 5, that means there's a shortage of staffing. So the hospital and the management would need to solve this particular shortage by implementing a policy which is recruitment policy. That means they would need to recruit further 2 nurses. If they have, say, 20 beds in the general ward, and or say 21 or 25 beds, whatever it is, say just as an example, 24 beds, and there would be a requirement of 8 nurses within the ward taking care of when patients and the beds are full. And if we have only 5 on the roll, then the hospital would need to implement the recruitment and staffing policy or procedure. And that would mean they would either need to recruit 3 nurses, or maybe look at an agency externally who would then provide them nurses on a need basis when the beds are totally full or the ward is totally full within the hospital. And they would have some contractual obligations in place which would allow that if they have to have shifts, and if these shifts have to be managed, then availability of adequate personnel has to be there to be able to provide this care to the patients who are admitted to the hospital. And that would be one such process which will be followed, because it has been pointed out during an inspection or during the routine say for example routine inspection, that there is a shortage of nurse, and that is where you would be looking at setting standards again to meet the requirements by recruiting more staff, and that is as per the guidelines and guidelines as dictated by CQC in its in its policy. The other could be when we look at, say, for example, staff are required to follow, for example, person-centered training, or 6, they have to put into account and follow the 6 C's of quality of care, which have to be implemented while providing, patient care services, or while providing care services to the patient. Now, in this case, if this has to be addressed, and if there are shortfalls which are uncovered while the inspections happen, or when management does audits, routine audits, in their let's say walkabouts to the hospital, or their general rounds that they take in the hospital, then they would be looking at addressing these issues, which would primarily be at some stage picked up by CQC and would be reported in their inspection report. So in order to not have these standards and not have these issues come up in the inspection report and standard slip, the management would be responsible to ensure that there are regular audits being done, and those are picking up on some of these shortfalls essentially, which would result in the quality of services being compromised. There could be other areas which I could probably list out in terms of suggestions for improvement would be, say, for example, empowering users and empowering staffs. Let's put it this way: there could be further training and development which could be done for staff, and this could be regular training, and this could be done regularly across the year, and that would keep the staff and their skills up to date in terms of providing some of the basic services and process that or let's say when they provide these basic services and they use some of the basic skills to be able to provide these services, regular training on those policies, on the skills, to keep it sharpened and keep it up to date and keep it in line with requirements for implementation can be done if staff is put into regular trainings. There could be, things like, audits and inspections done internally by the management. Now, rather than have an inspection by CQC or an external body or a regulator, if regular inspections and audits are done by the senior management of the hospital, then that would also ensure that if there are any slippages which are being picked up in quality procedures, then that can be picked up by the management, and they then can allow the staff to put corrective action in place to be able to get rid of those, slippages or negligence, or in some cases, services not meeting the requirements as what has been said by, CQC in terms of its guidelines and policy. So they would be ways in which you could look at, ensuring that health and social care services are going to overall help in the improvement in quality. One of the other things which you could also mean is that sometimes what you could do is set high standards, or set higher standards than the requirements or as prescribed, by regulatory bodies, so prescribed by CQC. Now, if the standard as prescribed by CQC is, say, for example, 3 nurses, per, 1 nurse per 3 patients. Now, if the standard implemented in the hospital, or they prescribe, say, 1 nurse across 5 patients. Now, if the standards being implemented within a hospital, as within just for example, they are trying to maintain higher standards, they could say we could have one ratio 1:4 rather than 1:5, which has been prescribed, or have a ratio 1:3, or one is instead of 1:5, which has been prescribed. So what here you're trying to do is you're setting higher standards than what are required, and that would ensure that even if there are slippages, or even if there are let's say slippages in some of these standards, they will still end up conforming to the basic requirements set by the regulatory body, or the regulator, in this case the CQC. So that brings us to the end of learning outcome 3 and the 3 assessment criteria we have discussed. I think the main point in this, in this learning outcome and the assessment criteria is talking about a named provider that you would need to have in mind when you start doing some of these tasks and the questions. And the other bit is to look at how quality systems and procedures are implemented. What are the factors which influence, the implementation of these quality and systems within the organization, and then what could be the improvement areas which need to be, put into practice, or could be looked at essentially when we look at, making these systems better, and obviously conforming to the regulations set by some of the regulators like CQC. So any questions on today's discussion, feel free to ask me now. And if you think of them at a later stage, you can also email it to me on learnerwork, at ukversity.co.uk. So we are going to be looking at covering learning outcome 4 next week. And until then, I would say go through some of the slides on the presentation. There are 1 or 2 good handouts which I've uploaded in terms of, quality policies and procedures, which could be useful for you to go through to get a bit more understanding, on the discussion that we've done today. And I will just try and briefly point that out to you on Moodle. They would be giving you additional information with regards to what we have discussed in today's learning outcome, learning outcome 3, and they are evaluating implementation of quality management systems in hospitals, clinical departments. So this particular handout is an article which is published in the International Journal for Quality in Health and Social Care, and is a good read, a 10 minutes read. 10 to 15 minutes read, which would give you some idea in terms of how these systems are implemented, and obviously why they are required to carry out inspections from time to time to ensure that some of these systems and policies and procedures created do not have gap areas. Then the video which I had shown you earlier, talking about how changes are coming to the National Health Service and how these changes would be implemented, is also given out in the Department of Health and Social Care handout, which is about an 80-page handout. It's quite detailed because it focuses on the suggestions and also focuses on the aspects of when we talk about what suggestions can be done or taken into account for implementing improvement within the organization, and what could be the factors which influence the implementation of quality system. That is something which is covered in a bit more detail here. Some parts of it might not be required, but essentially you would be looking at reading into how proposals are done, how the changes to legislations are introduced, and this is something which is available in section 2 of this handout. I would say give or take about 10 to 13 pages is what you would you'd be looking at reading, and they will give you a good understanding in terms of why the legislation is required in this sector, and what is the role the legislation plays in terms of ensuring that the standards are maintained within a health and social care setting. And then the last bit, when we talked about the suggestions for improvement, now when changes in legislation happen, if you look at the Data Protection Act of 1998, it was revised in 2016 with the implementation of, or the incoming GDPR guidelines, General Data Protection Regulation. This is where the revision of the acts and legislations also happen, and that is something which is important because it is keeping in line with the changes which are happening in the requirements, and those are being implemented by bringing across changes to the acts and legislation as well, and that would be explained in this particular handout. So I hope you'll find these two handouts useful in addition to listening in and reading through the presentation that we have discussed in terms of talking about how to evaluate systems and policies, system policies and procedures in health and social care to cover learning outcome 3. Thank you so much for attending, and I will see you next week. Bye for now.